This topic is on the CVI range, and we're going to talk about some of the structural aspects of the CVI range, some of the purposes, and hopefully answer a few questions that you may have about the operation or mechanics of the CVI range. So the CVI range is used to determine the degree of effect of CVI. It is a functional vision assessment that is designed for children with CVI. It is a replacement for the functional vision assessment that is traditionally used with children with eye disorders, and this one is designed specifically to meet the needs of children with CVI. So the CVI range operates by deriving a set of scores. Those scores will be on a 0 to 10 scale. You actually derive two scores, which become the range. It has been found to be a reliable and valid instrument based on the work of Sandra Newcomb. Dr. Sandra Newcomb works at the University of Maryland, and she did an extensive study looking at many of the aspects of reliability and validity of the CVI range. If you're interested in finding out more about what she examined, she published an article on this topic in the Journal of Visual Impairment and Blindness, October 2010. It also is used for individuals who are 6 months to 21 years of age. Okay? The CVI range is used to determine the degree of effect of the characteristics associated with CVI. The 10 visual and behavioral characteristics that are essentially the defining features of CVI. The reason that this test can be used with children who are 6 months of age, very young, all the way through individuals who are 21 years of age, is that it is not based on a developmental model, but rather on a model that examines the progression of these characteristics. No matter how varied children with CVI can be, children with significant multiple disabilities to children who have no additional disabilities, those who have significant cognitive challenges, and others who may have gifted abilities, the thing that holds these individuals together are these 10 characteristics. So the CVI range can be used with individuals of really varying backgrounds, varying medical causes of CVI, varying other features. But what simplifies children with CVI, what helps us kind of wrap our arms around them and begin to sort of figure out the language of CVI for that child are these characteristics. So the CVI range is used to consider these 10 visual and behavioral characteristics using two methods. You will obtain a CVI range score based on a set of statements that create kind of a snapshot of observable behaviors. That's called the Across CVI Characteristics Rating, or Rating 1. And those are observable behaviors that have touch points that describe how some of the characteristics look at various levels. Those levels improve as the child gets higher on the score, as the number increases. Those are, again, behavioral statements, things you can see and test out and watch and observe and ask about based on behaviors. The second score is derived within CVI characteristics. So each of the characteristics, color, latency, movement, complexity, and so forth, will be looked at in terms of the extent of the effect of that individual characteristic in isolation. This rating 1, where we look across the behaviors using these behavioral statements, may combine many characteristics even within a single statement. But in rating 2, we are going to simply become very focused on each characteristic and determine the degree of effect of that characteristic. It's important to recognize that the interventions flow from the score of the CVI range. So I can't really say strongly enough how critical it is to recognize that the score in and of itself is almost meaningless. It tells you the degree of effect, but why? Why do we need that? We need that piece of information so that we can properly design interventions, so that we know that sort of, Goldilocks just right place, the place that's not too high, not too low, but really meets the child's needs at that distinct level. So I also want to share that the information that you derive from rating 1 and rating 2 has specific implications for the IEP. That in rating 1, once you determine, and we'll talk a little bit about how the scoring works for rating 1, but those statements, like, for example, one statement may be demonstrates prolonged periods of latency, or another statement may include movement continues to be an important factor for visual attention. When you get those pieces of information, because they've been scored as a plus or true of the child, all of those pluses can be lifted out of the range and placed into a description in the IEP or IFSP of the child's present levels of visual functioning. You don't have to recreate this. You don't have to think it up separately. That once you score the range, those plus statements actually become the present levels of functioning. And so that work is kind of done for you. When you do complete rating 2, where you look within the characteristics and you determine the degree of effect of color and latency and novelty and distance viewing and complexity and so forth, every one of those characteristics that is not scored as a 1, in other words, that is not fully resolved, becomes part of your accommodations page of the IEP, except for reflexes, which are not really teachable. So in the accommodation page, maybe you've learned that the child still requires a great deal of movement to attend. Maybe you've learned that the child has prolonged periods of latency, so you'll write in there that as an accommodation that adults should provide ample wait time for latency and so forth. So the 2 parts of the range not only give you 2 scores, they also give you 2 sets of information that help you build the IEP. The components of the CVI range that have to do with gathering the information include information from observation, from interview, and from direct assessment. That we look at the behaviors the child shows us, the observation, we watch them in living and learning settings. If I'm seeing a child at Pediatric View in Pittsburgh, my observation of that child begins as soon as I open the door, welcome the child, welcome the family. I begin to watch the child like a hawk, because what I want to try to do is to use every opportunity to see if any of those characteristics begin to emerge. For example, if the child comes into our assessment room, sits down, and begins to stare at the lights, I'm going to make a note of that. That's an observation I need. If the child looks directly into their parent's face with eye-to-eye contact, I'm going to make a note of that. I didn't even have to ask yet. I'm watching that. If the child comes into the assessment room, a new space to them, and doesn't show any visual curiosity, doesn't notice the toys in one area of the room, doesn't notice pictures on the wall, doesn't notice really anything, I'm going to make a note about visual novelty. So my observation is really critical. The second component is interview. And the interview is a very rich process in which we ask a distinct set of questions that help us get at or derive information that is held by someone who knows the child well. When I was doing my doctoral work in 1995, I sent out a set of 50 questions to people internationally who had expertise in CVI. I asked those individuals to rate those 50 questions in order to isolate the ones that would be the best questions to ask about getting at those traits of CVI. The 25 that were most highly rated became the interview questions and also became my dissertation research, which helped us see that there are really different ways that parents answer questions about their child's vision if they have CVI, distinct ways, actually diagnostic ways. So if we ask those questions about color and movement and whether your child prefers looking at a new object, or if you give them something they've seen many times, what would they look at? Those answers are rich, rich, rich pieces of information for the range. And the third component is direct assessment. That's what I do when I sit knee to knee with a child and actually manipulate objects and do very specific things directly face to face with the child. I cannot emphasize strongly enough how important it is that all three of these elements be part of the CVI range. If you just do interview, you have not done the range. If you just do direct assessment, I sit down, I work with a child for a while, and then attempt to score the range, your range scores are very much at risk for accuracy. I'm always intrigued by the fact that people feel they can do kind of one section of the range, or they can do one portion of either interview, observation, or direct assessment, and that they come up with a score, because I know I certainly can't. So I would like to just re-emphasize the importance of doing all three components. So some of the things that have helped me, and I think I've learned from individuals who use the range, that it can be helpful to take detailed notes on each of those components. So as I mentioned, when I'm observing the child, when I'm doing the interview, and when I'm sitting knee to knee with a child, I write copious notes about what I have learned, because one piece of information does not give you the answer that you need. What you need to look for are patterns. So if I see the child stare at lights, then I ask the parent, is your child interested in anything in your house in particular? What do they like to look at? And the parent said, well, not much, but he really likes to stare out the window at the light. Or we have to turn the overhead lights off. Oh, there's another piece of information. And then if I'm working directly with the child and I pass a light in front of their eyes and they keep their eyes wide open as they look at the light, that's a third piece of information. Now I feel pretty confident about my score relative to light. So take notes, don't make judgments until you get all the information you need, then look for patterns. These three components support each other in your determination of the scores. So, the score that you get is only as good as sort of the operations that you have used to get it. So here's where some people have issues doing the CVI range. One is scoring. That people wonder sometimes, what was Christine Roman thinking? And of course, that's something we will never really know the answer to. But what I think I was going for here is that I wanted to be able to have a way to look at the present and the past and think about the future, all within one testing protocol. So the scoring for rating 1 involves using an R, a plus minus, and a minus. In rating 1, there are statements, including, for example, the statement has prolonged periods of visual latency. If that statement may have once been true about the child, if the parent says, well, yes, when he was little, he had so much latency, about the time he turned 3, we'd started to notice there was less. I would mark that statement as an R, because it means that statement is resolved. The child it may have once been true of him, but he is now well above that level of function. A statement of plus means that the statement describes a current behavior, that it is true of the child today. Based on observation, interview, and direct assessment, it's true. Those, as I mentioned, those plus statements can become, when you collect them up, can all become statements of present levels of visual functioning. So the pluses are quite critical. The plus minuses mean that the statement is neither totally true nor totally false. It represents an emerging skill. It could be true part of the time, but it is neither completely true nor completely false. As I said, it is an emerging skill. And we have to have a place in my opinion, we have to have a score that gives us that kind of emerging information. And the fourth way that you can score those statements involves the score of minus. The minus, scoring a statement as minus means that the behavior is more advanced than the student or this child is at the time you assess them. So if the statement says, can detect targets at 20 feet or greater distances, but this child can only see things that are 4 feet away most of the time, I would mark that statement as a minus. They're just not there yet. Okay. I want to go back and say another thing about these R plus, plus, minus, and minus scores. People have often asked me, why is that R there? What is the R? Why can't we just have plus, plus, minus, or minus? Or why can't we just have plus and minus? Because honestly, I think that the information is that it's important to get the subtleties. It's important to understand what's emerging. And the R is also important because it represents something that may have been true about the child, but they have moved past it. And when parents can see that the plus statements have turned, some of those plus statements over time turn into R's because that statement represents a resolved behavior, it's extremely encouraging. And it's a way to kind of plot a history. It's been my experience that educators find the R's less gratifying than parents do. But I think they're important to keep because we should all be plotting this progress and expecting to the greatest extent possible that the pluses will turn into R's. In rating 2, if you think about that page that has the list of characteristics and then a designation of next to the list of each characteristic, there is a value. The value can be 0, 0.25, 0.5, 0.75, or 1. And we score each of these characteristics. So let's say it's a characteristic of, movement. We would score that characteristic with a value of 0, 0.25, 0.5, 0.75, or 1, based on how resolved that particular characteristic is, knowing that 0 represents a full effect. So for movement, for example, it would mean that if it's a score of 0, that the child only looks at something if it's moving or shiny, and if it stops moving, the child stops looking. So that means 0 means a full-blown characteristic. This is not a value attached to the child or attached to the child's level of cognition or any other thing. It really simply means how far along is that characteristic relative to resolution. A score of 1, if you circle the value of 1 for our example of movement, it means that movement is no more important for this child than for any other child their age. And that is a very hard thing to achieve. So we circle the values of 0, 0.25, 0.5, 0.75, or 1 based on our understanding of how each of those characteristics changes over time. And in the end, when you're done with that process, you add the scores up. Okay, so in rating 1, we come up with a score for the CVI range in rating 1 with the R's, the plus minus, the minus, by looking for a ceiling effect. Where do the pluses end? Where do those pluses end? And if they end at the end of a cluster, like a cluster of 3 to 4, and they get R's or pluses all the way through the 3 to 4, and then in the 5 to 6 cluster, they don't get any pluses or R's, it means that child obtained a score of 4. Their ceiling effect was 4. So we look at that in terms of ceiling effect. In rating 2, we add all the values that we circled, simply add them up. Now, a misunderstanding about the range is that we average the scores, that if you get a score for rating 1 and a score for rating 2, so you get a score of 5 for rating 1 and a score of 4 for rating 2, that your CVI range score is 4.5. Well, the reason that may be misleading is because on the form it says to do that. But what I'm suggesting is that that we now actually keep both of those scores. And in future changes to the CVI range, that cover sheet will be changed so that you actually keep both of those scores. Because by having both the 4 and the 5, you see that as the range. That little spot between 4 and 5 is approximately where this child's functional vision is. So here's some tips about doing the range. One thing I suggest is that you assess with another partner until you're confident with your scoring. I would suggest this is really similar to doing any functional vision assessment, that we're all a little uncomfortable at first with any new kind of test that we're going to be giving. So if you can find a partner or you want another observer for a second pair of eyes to see if they're observing and hearing what you're hearing, that's great. In our clinic at Pediatric View, on the days when my husband is working with me, he is that second set of eyes, and it's wonderful to have someone who can actually kind of co-assess with you for your own reliability to see if you're seeing things the same way. Another one that I suggest is do not overthink your observations. That sometimes people will spend much too much time trying to analyze all the information they got when really they know the answer already. So begin to trust your scoring, begin to trust your observations. Another tip is that you should not eliminate a portion of the CVI range. So you have not conducted the CVI range if you've only done rating 1, or if you've only done rating 2, you have not completed the CVI range. Those two scores are meant to support each other. And one of the beautiful things is when you begin to consistently see that your scores for rating 1 and rating 2 are within about a point of each other or less, you can feel pretty good that you're answering the two sets of questions about this child consistently. And in no case should the scores for rating 1 and rating 2 be further apart than 1.5 points on the range. Another tip, another thought about this is that in my experience, people who do the CVI range may have a tendency to overscore. That when you read some of the statements or you think about those characteristics in rating 1 or rating 2, that we tend to sometimes give credit for the sometimes occurring thing rather than what is the standard, what can this child do all the time. So for example, in distance viewing, many people will see, a parent may say, he sees the train out the window. When the train goes by, and boy, that's at least, 100 yards away. He can see that train go by. 100 yards is not this child's distance viewing ability. The next questions should really pertain to, well, let's see. Show me something that he likes to look at. Maybe they get out the iPad. Maybe they get out a favorite object, a toy of some kind, a truck or a Elmo or what have you, a slinky. Place that object in a novel setting at varying distances. That will be that child's distance viewing. Distance viewing is the score in which is the distance at which the child can always find something in a novel or familiar setting. That they can see something further away is great, and we need to add that information to our report. But that's not this child's constant distance viewing. So I use this example just to share that we're looking for a score to achieve those higher scores. Remember that you have to convince yourself that the way you're scoring this is true of the child almost all the time. We can also use the phase 3 extension chart that's available in my book to help support your thoughts around phase 3 and to also help sort of analyze some of those components in scoring the CVI range, especially when the child scores 7 or above. Also, I've noticed, without a doubt, that when people begin doing the CVI range, when they begin to conduct this protocol, that they first get really good at assessing a child in phase 1, and they're really reliable all the time with other evaluators. And then they get good at phase 2, assessing children in phase 2. And finally, getting competent, having skills that are really accurate for children in phase 3 comes last. So just because you can assess a child in phase 1 reliably, please recognize that your experience and other people's input and doing reliability checks with your peers is really necessary as that child gets at a higher and higher score to make sure you're just as good at scoring someone at 7 as you are at scoring someone who scores at 2. Also, if you score a student at 10, so remember the CVI range is 0 to 10. If you score a child at 10, I always say call me, because I've seen so few children, very, very few children who actually obtain a score of 10. 10 means that child's vision is exactly like other children of their age. And that almost never happens. So I would say that it is mandatory that you review your CVI range score with someone else who also conducts the CVI range. That you should assume that score is incorrect until someone else and someone else and someone else indicates that it is correct. Even a score of 9 is something that I would really suggest you make sure you're getting some additional input on. I also would like to mention that as a child's CVI range score increases, we'll talk about this more, this really kind of dovetails more with interventions, but there is no relationship between the child's CVI range score and the degree of support they need. In fact, there may be an inverse relationship, that the higher the score gets, the more support that child needs, because it indicates that they are using both peripheral, dorsal, and central, ventral, stream vision, and that they are using their vision increasingly for most tasks in the day. Therefore, many, 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 many of their educational materials and experiences will need to be adapted. So in no way am I trying to reflect that the higher the score, the less support the child needs. Also, if we can just reiterate one more time that a score in the statements in rating 1 being marked as an R, or in rating 2 being circled as a 1, mean that you have determined that that child's visual function relative to that characteristic is just like other children their age. I say this because I have to really caution all of us to not overscore a child's CVI range, and that is kind of the tendency, that interventions flow from that score, so the correctness of that score is vital.